Hey guys, it's Paula Nutting, your musculoskeletal specialist. This time I thought we'd look at an anteriorized ilium. So it's the same symptom picture, which means we're checking for iliac crest heights, and they should be even. Sometimes they can be a little bit out of whack, and that's because the ilium can be either anteriorized, so the back portion of the iliac crest can be looking like it's a little higher, or posteriorized, which could look a little bit lower. That's really subjective. We're going to have a look at our modified stalk test, which means thumbs just below the PSISs while they do a leg lift. We expect to see the leg moving, and as it moves, we're going to see our thumbs roll down, because when we fixate on that spot and she's going to move her leg, the hamstring pulls at the ischial tuberosity and the whole ilium moves. That's normal. What we don't want to see is no movement, or worse still, an up slip or a movement up, which means that there's really dysfunction in there, and the contralateral QLs or the lateral trunk flexors are actually trying to elevate to maintain some kind of stability, and we just don't want to see that. So if we've assessed that there's an anteriorized ilium by looking at PSIS, one's on this side is higher, and that means that this is going to be up higher and this one's going to be lower. We can have a look at our leg lengths, and we will also see that with an anteriorized ilium, so it's twisted like that this leg will be longer because the femur sits in the acetabulum and comes down a little bit. So how do we treat it? Super simple. Here's my wonderful Brooke that lives on the same floor. She's perfect, and she's all about helping with these. So we're going to take that leg and we're going to bring it up onto our hip. So it's like you're holding a baby. One hand is going to come at the front of the ASIS, AIIS, and the other hand is going to weave around the iliac crest. And if you're palpating along, you'll feel the sacral notches there. So what we're doing is we're rocking. It's actually this part of my ulnar radius complex. I can feel her ischial tuberosity, and I'm rocking back and forward. This is really a joint MET, and that's the ones that Fred Mitchell talked about when he was looking at his osteopathic options to high velocity end range thrusts. So gentle rocking. Once I feel that bind at the back, I'm going to get Brooke to try her to, she's doing hip extension, but not knee extension. So can you push your knee into my body? So she's pushing down that way, but she's not trying to keep me. Does that make sense? We've got 7 seconds. After 7 seconds, cleansing breath in and relax as you breathe out. And we know that there's a relaxation phase, and breathing in and out will actually assist in dropping the blood pressure a tiny bit. It also helps with deregulation of the nervous system. So we're going to hold that and then re-rock. It's really interesting that 90% of people that have got ilial rotations tend to be anterior and tend to be on the right. Okay, pushing again for me. So don't let her move at all. Remember, it's minimum 10 seconds. And I like to say 7 seconds and a breath in. And relax me out, breath. And you actually don't have to say breathe in, because all you have to do is go. And it's kind of like this auditory cue for them. This relaxation point can be up to 90 seconds. You don't actually have to do that, but that's the length of time you can get changes in your post-contraction relaxation phase. And I can actually feel the sacral moving a little bit better now. I don't know if you actually had major issues in here, but she's a dancer and does a lot of gym, does a lot of everything. So she's a little tight, a lot of Pilates, a lot of yoga. Okay, one more time for me, thanks for pushing down into me. And it's super comfortable for me because she's just pushing into my lateral hip thigh area. And there we go. These are fantastic to use in anything that's involved with the pelvis and the sacrum. And again, when we take that leg, make sure you hold it and you bring it back to not make her contract through that range. So what we're going to do is get Brooke to lie on her back for me. So when she rolls over onto her back, I'm going to get her to bend her knees up, feet flat. Make sure her toes are in line. Can you just push your bum up in the air a little for us? And down. So I'm just doing a Weber-Barstow test. So we've just got her to lift up. I move her legs, but I don't pull them because that's a no. And we look to see if her medial malleoli are in line, which they are. And we look to see if her ASISs are in line, and they are. So we've done a really good anteriorizing and posteriorizing of her ilia. Thanks. It's Paula Nutting and Brooke. Over and out.